Hi everyone, welcome back to the Pelvic Health Project. It's Dr. Lloyd, and today I'm going over step 2 of our Healing Pelvic Pain Series, which is going to focus on stretching your pelvic floor muscles. So there are 2 ways of stretching out your pelvic floor muscles. One way is going to be manual or mechanical stretching. So if you have a pelvic PT, she is likely going to help you by manually stretching your muscles. If you don't have access to a pelvic PT, then there are some ways that you're able to do this on your own at home. So to be able to do this at home, you are likely going to need some tools. One of the most common tools that are used for stretching pelvic floor muscles is called vaginal dilators, and I'm going to go through that with you today. The first set I have is a pretty common set. These are silicone dilators from Intimate Rose. And so this is what they look like. You can see that smallest one is probably similar to the size of my pinky, and then they will progress from there. This kit goes up to a size 4. Intimate Rose in general goes up to a size 8. But so let's talk about dilators. Why do we use dilators? Dilators are used to stretch out the vaginal canal, pelvic floor muscles, particularly for women who are having painful intercourse, right? So if you're having vaginismus, dyspareunia, also known as painful intercourse, we need to be stretching out the vaginal tissues or your pelvic floor tissues to be pliable enough to have comfortable intercourse. So if you have vaginismus or a hyperactive pelvic floor, then your pelvic floor muscles, particularly the opening of the vagina, most of the time is just not stretchy and pliable enough to have intercourse comfortably. And dilators are used to help stretch that out. So I did show you the silicone dilators because they're most commonly used, but I'm not crazy about them for 2 reasons. One, silicone dilators are typically pretty flexible, as you can see. And 2, with the silicone, there's a little bit more friction, which is okay. But the other part I don't like are dilators that don't have a handle. So I'm going to show you the dilators that I prefer. I do want to tell you that if you already have a set of vaginal dilators, you don't need to worry. Don't bother getting a new set. Just use what you have, okay? If you are using silicone dilators, remember that you should not be using silicone lubricant with it. You should use a water-based lubricant. If you use silicone on silicone, it gets quite messy. It will start to roll up and form into a solid. But in any case, let me show you the dilator set that I do recommend that my patients use. I will do my best to put some links below, maybe my Amazon links below and where I got this set. The set that I like, as I mentioned, has a handle, and I'm going to show you in just a little bit why that matters if you're using this on your own, just for maneuverability. Okay, so again, we have that small dilator, and then they go up in size. This is the level 5, and then lastly level 6. You only need to go up to the size of your partner, so please don't let that scare you. Okay, so say we're using a vaginal dilator. Let's talk about how we use them, okay? Most people are going to start a little bit larger than a finger, particularly if you have vaginismus or just painful penetration. So say we start with a level 2, right? Just maybe the size of a thumb. How we use this is we insert it into the ring and then we turn to lock it in place. Now, if you're starting with a dilator, I always want you to put just a little bit of lubricant at the tip. You don't need to lubricate the whole thing. And then what we do is we slowly start to penetrate through the vaginal opening, right? Go slow. If you feel any more than a 3 out of 10 pain, I want you to pause and just hold there. Some of you will experience that sensation of hitting a wall, and feeling like, oh, it won't even penetrate, right? This is what I'd like you to do. If you try to penetrate through the dilator and you meet some resistance, meaning that closure, I want you to hold steady pressure there. Don't try to force it through. Hold steady pressure. This is where we're going to use the techniques in the first video, where we do deep breathing and reverse kegels. How can we get our pelvic floor muscles to open and relax to allow that dilator to penetrate through? Okay. Once you're able to insert the vaginal dilator, I would say 70-80% is probably all you need. You're going to hold it there. You're going to hold it there, I would say, for, well, the first time you use it, you may just hold it there for a few minutes, and that's all we do the first few times. By the time you're through your first week, we've used it 5-6 times, that should get quite comfortable, meaning a static hold with the dilator becomes quite easy, which is great. That tells me that your muscles are responding, your tissues are stretching and getting used to that opening and that stretch, and it's getting more pliable. And so now we begin the next step. We take the dilator, and instead of inserting it straight, we will begin to angle the dilator, right? So we angle sideways toward the back wall or posterior wall, and then the other side. You're gonna spend 30 to 60 seconds on each spot. If you find a spot that is tender, that's where I recommend spending a little bit more time on the stretch. And what that's going to do, using the dilator to stretch, is going to get you to progress to the next size. Okay, and then obviously we do the same thing until we are able to progress to the size of your partner, and that should help you be ready to resume comfortable intercourse. Okay, anything else we need to talk about dilators today? Let's talk about how long, right? So dilators should be used, I would say, minimum of 5 minutes, somewhere between 5 to 10 minutes a day, where you start with just a static hold and then you use it to dynamically stretch, just like I just described earlier. And I would say most days a week. So 4 to 5 days a week should do it. If you can get it in daily, even better. But otherwise, I would say 4 or 5 days a week of consistent stretching will get you through the dilators and having stretchy pelvic floor muscles rather quickly. The reason why I say it needs to be most days of the week is, let's say you use your dilator once a week, right? You use your dilator on Saturday, come back to the next Saturday, your muscles will likely have contracted back to the way that it was, and that dilator is going to be just as uncomfortable as it was a week ago. So the whole point of using dilators is literally to stretch and get your muscles more pliable so that we can, over time, get it back to a normal pliability and opening, right? So if we're using dilators, it's likely because we either have a tight, that we have tight or tense pelvic floor muscles, also known as a hyperactive or overactive pelvic floor. The other main reason we use dilators is if the vaginal opening is more narrow than it should be, and we're literally trying to open up the vaginal canal to make penetration, tampon use, intercourse, pelvic exams more comfortable. Okay, so moving on from dilators, I'm going to get into a pelvic wand. So let's say you're someone that doesn't necessarily have pain just with intercourse. You also just have general pelvic pain. This is when a pelvic wand would be more appropriate for you. So this is what a pelvic wand looks like, and you can tell that it's very curved. And this particular one is also made by Intimate Rose. I do like their products as far as their pelvic wands, and this one in particular vibrates. So there's a little button on the side here. If I press it, you'll see that there's a little light that comes on, and you can't tell by looking at it, but this thing is vibrating right now. And the reason why we like to use the vibration is if you have hypersensitivity, right? So if you're someone that has chronic pelvic pain, perhaps pudendal neuralgia or some kind of vulvodynia where it's very, very tender or sensitive just to touch the vulva or the vaginal tissues, then we may want to try something like the pelvic wand instead. We can begin by just placing the vibrating option just on the vulva of the vaginal tissues. I have a pelvic model here just to demonstrate, and we can use it just around on the vibrating, what am I trying to say here? On the vibrating option, just to get your tissues to be desensitized. Once that becomes more comfortable for you, you can certainly use the wand as well to use at the very opening of the vagina to stretch. So the one thing you're going to get out of the wand outside of the dilators is really getting the hard to reach areas. So as you can tell, you're getting a lot of curvature with this. That's really going to allow you to reach areas that you can't otherwise. So if you have not just tightness of your pelvic floor muscles, let me correct that. If you have tightness, not just of the vaginal opening, but of your deep pelvic floor muscles, it's very hard to reach with a dilator because it's so straight. And most of the time, your pelvic PT will be helping you do this. But if you don't have one, or you need to learn how to do this at home, this is where the pelvic wand is going to help. So you can see it. Let me just go over the anatomy a little bit. So I have a pelvic model here. We have the superficial muscles on the outside, and we have a bowl of muscles here on the inside. So if you're having pain in your deep pelvic floor muscles, you know, your pelvic therapist will come in and with her finger work on stretching. You're not going to be able to do that on your own. And that's when using a wand through the vaginal opening, it will be able to curve and reach those really hard to reach areas as far as releasing those tight or tender either trigger points, which means that you just have knots in your pelvic floor, or just your tight pelvic floor muscles. Okay, so moving on from the wand, we're going to talk about some other tools that are a little bit more easy to use. I like to use balls, and so I use balls for sitting, right? Because there are two ways that we can manually, well, there's more than two ways. There's lots of ways that we can manually stretch the pelvic floor muscles or mechanically stretch the pelvic floor muscles. But as I mentioned earlier, a lot of the tools that I just showed you, the wand and the dilator or your pelvic PT, if she's doing manual or you're stretching yourself, you're going inside out, right? So if you're inserting something inward and we're pulling to get some outward stretch through the muscle. Well, we can also go the other direction. So externally, instead of going outside in, instead of going inside out, we're going outside in, right? So for a lot of people who have pelvic floor muscle tension, I will just work on the I'll work both inside and outside. But for the most part, if I put even some gentle pressure through the pelvic floor muscles externally, they'll have some tenderness there as well. And so one way that you can work on that on your own is stretching with a ball. This is a wool ball that you can use, that is used primarily as like a dryer ball, but that you put in the dryer and it keeps your clothes from wrinkling. But it's great for this as well. It's quite soft and squishy. And I love this for women who are postpartum and have perineal restrictions. So if you've had a baby, you had a tear and it's healed, but maybe it hasn't quite healed up completely or in a way that's comfortable for you, this is a great way to stretch that area. As I mentioned, if you just have general tightness, just get that ball. You're going to sit on it right inside of your sit bone, and as you sit on it, that you may feel a little bit of tenderness to start, and eventually the ball is going to sink in and help you stretch out those muscles. Like I said, one side and then the other. If you are someone that has some scar tissue from labor, you might want to sit on it right straight in the dead center where the perineum is, because most women are going to have tearing or their scar tissue or restrictions right here on that back wall of the vagina. So I want to remind you guys that there is no bones in the middle, right? So it's all soft tissue in the center. There should be plenty of give. We should be able to sit on a bicycle seat without pain. But if you are having some tenderness there, then that's something we want to be able to work through to restore your pelvic health. So at some point, hopefully the next couple weeks, sitting on a wool soft ball is easy. Doesn't bother you, no problemo. Then we can move on to a tennis ball. Tennis ball obviously is firmer. For some people, it may be too firm, and if that's the case, just fold over a washcloth, set it on top of the ball to give it a little bit more, to kind of cushion it a bit, and then sit on the ball that way. Same thing on the sides. Once you get to a point where sitting on a tennis ball is no longer bothersome for you, meaning you feel the pressure, it's there, but it's not painful, it's not tender, then your pelvic floor muscles are likely not very overactive or tight or tense anymore. Okay, so those are the tools that I wanted to review with you guys today. We have dilators, pelvic wands, balls to sit on. All of those three things are going to help stretch, mechanically stretch your pelvic floor muscles. What I'm going to cover in my next video is the third step, and the other way to stretch your pelvic floor muscles is going to be through exercise, specifically stretching exercises. A lot of them are going to be some yoga poses, happy babies, child pose, butterfly sits, etc. I would say that if you're having a lot of pelvic pain, you likely need both, some kind of manual or mechanical stretching along with stretching exercises. Okay, that is all I wanted to cover today as far as stretching your tissues with tools, and I will be back soon with my next video on pelvic stretches. Okay, so thank you so much guys for joining me today. I hope to see you in the next video. As I mentioned before, this is not a substitute for medical treatment. If you guys are experiencing pelvic pain, please see a healthcare provider that's going to assess you and find a specific plan for you that's going to help you through your issues. Okay, this is more so just broad education for everyone, tips for you to work on at home, but everyone should have someone that they're seeing so that they get their specific needs met. As I always ask you guys, please ask me any questions you want, comment below. I am always looking for ideas for a future video, so ask me anything you want and I'm happy to answer your questions. Thank you so much, and I'll see you next time.